10 years ago, the only hospital on Oahu's North Shore was on the brink of shutting its doors. Nikki Schenfeld now with more on how the hospital has not only stayed open, but is looking to future plans and the importance of its location.
Kahuku Hospital opened its doors 89 years ago. In 2008, the state passed legislation to let Hawaii Health Systems Corporation assist and keep the hospital open.
The hospital was struggling, lack of volumes, lack of services. In fact, they were cutting back on services dramatically, trying to save the money.
One service cut was OBGYN back in 2005. McAfee tells me women who live nearby pack their cars in case they have to deliver in the car.
If you look at a map, there's no hospital between Castle, down in the Kaneohe area, and Wahiawa.
McAfee hopes to bring back many services, including OBGYN care.
Traffic going either way from Kahuku to get to Castle or to get to Wahiawa. Wahiawa is a little bit harder because you got the surf, you got the tourists, you got Laniakea Beach. Anything can happen in 30 minutes. Especially during labor, you never know what can happen.
McAfee tells me the hospital sees 500 to 550 emergency visits a month, and their location is crucial come winter when they see an influx in emergencies.
So a lot of them is either drownings or surf injuries, with the boards, especially during competition time. We do have a lot of those that come in.
Quinlan saying the increase in visitors to the North Shore is another reason he's glad the hospital has remained open.
And I would argue that today, Kahuku Medical Center is even more critical than it was 10 years ago due to the constant bottleneck at Laniakea. So now it's not just for residents of Kolauloa, but for many residents of the North Shore if they were to suffer a medical emergency.
The CEO tells me they've acquired a mammography unit, which will be in place by the end of this year. They've also secured $1.6 million to expand on future services. Nikki Schenfeld, KHON2 News.